My name is Dr. Satheesh Kathula. I'm the president of AAPI 2425, and we represent a lot of doctors here, several thousands, also in India. We are doing some things. For example, Global Health Summit this year, which is going to be held in New Delhi, October 19th and 20th, and we are going to meet the health minister there, and also we will be speaking on so many things, such as how to prevent cancer, how to prevent heart attacks. The theme is around prevention of cancer and heart attacks using lifestyle modifications and technology. So we'll have the experts in those areas from here, also from India, and we are presenting a white paper to the health minister, Mr. JP Nadda. We're also planning to meet Prime Minister Modi ji. Hopefully, we'll get an appointment with him. So the thing is, if we can make some policy changes and focus more on prevention, and that'll save a lot of lives, a lot of money. An ounce of prevention is better than a pound of cure, as the saying goes. So that's why we want to focus on prevention this year. Preventing chronic diseases is very important because these contribute to 70% of the deaths. So at the same time, we cannot really focus on all these. So that's why we chose two major diseases, which is cancer and heart attacks. And eventually, we may expand this to other diseases, but for this year, we'll focus on two. And hopefully, we'll make an impact. Rural population is about 70% in India, 30% live in cities. Definitely, there is a disparity between the cities and the rural areas. Cities have PET scanners, MRIs, CAT scanners. I mean, very sophisticated, better than in US, and they're able to afford that because there are people who want to get these things done. But in rural areas, there is not even a single X-ray machine they have, and that's not just unique to India, but anywhere in the world, rural areas suffer that. And here, people drive like 30 to 60 minutes or even 2 hours to get treatments. I mean, they come to me as an oncologist from 2 hours away from villages and things like that. So it's a challenge everywhere, but more so in India because people are, even if they live in rural areas here, they are educated, they are aware of the healthcare, they can drive. So it's a very different situation, different culture. But in India, it's very sad that people in rural areas do not know a lot of things. So that's why we need to educate them. So how do we do that? We have to strengthen the healthcare workers. So it is very hard to open a hospital in every village. But if they do have infrastructure, but how to utilize that properly is the issue. So healthcare workers should refer the patients to right hospitals at the right moment. All these things. There are so many healthcare workers in India, so we can work with them. It is just the making them function properly. That is the issue. But every district center has a big hospital. Taluka centers have a little smaller hospitals, and rural areas have PHCs. For certain number of villages, they have one primary health center. So these are all there, but we need to have doctors properly. We need to have medications. We need to have transportation available for them to go to the nearest hospital. So that's what we need to focus on. I think we have enough infrastructure in India. Is there room for improvement? Absolutely, there is. But for now, how to make the things work that are existing is what we have to work on. So here is my invitation to all Indian doctors and Indian experts in healthcare to attend Global Health Summit, 18th Global Health Summit in New Delhi in Le Meridien Hotel on October 19th and 20th. 20th is the main program. So please do come, attend, and give your input and make an impact. Thank you.
Good evening, Namaskar. This is Binay Pradhan, Consul General of India in New York. It's a true pleasure to be here at the annual retreat of AAPI, that is the Association of Physicians of Indian Origin in the United States. And when Dr. Satheesh Kathula invited me for the annual retreat, I was really happy that they decided to host it at the Indian consulate. As an Indian consulate, we work very closely with AAPI, and we are familiar with the great work they are doing, both in the area of healthcare, but also the work they are doing in India, in terms of being a strong pillar of support. Even during the COVID time, we all know what they did for the people of India. But otherwise, also they are greatly connecting the healthcare sector of United States with that of India. So I'm truly thankful for the great work that the members of AAPI individually and AAPI as an organization have been doing in fostering a strong healthcare cooperation between the two countries, and also what they are doing for the motherland, India. So true pleasure to be here and spending little time with them. Thank you.
Hi, this is Dr. Hetal Gaur, board certified practicing OBGYN in New Jersey. I'm a board of trustees of National AAPI. This is my second year as a board of trustees. We had an amazing event today at the Indian Consulate, and we thank our CG, our Consul General, for providing us this space, and Dr. Satheesh Kathula for having that trust in me to pull off this event. We did the leadership courses earlier in the day. And then we had first of its kind a media meeting where we did a press conference. We had more than 20 plus media come. These are just Indian medias in United States that came together, and we gave our vision of RP, what RP can do for the diaspora in United States and back home, how we can work together, what can we do to improve the image of RP, and how the power we have as an Indian physician, how we can affect the constitution, the policies of US government, and our experience of United States collaborating that with Indian physicians. I think that's what we are looking into. And our media friends were amazing. They asked really good questions. They are going to put us accountable, and this partnership is going to hopefully continue in next administration going forward. Also, our leadership course was really amazing. I had invited the special guests from different fields to give us their input about what leadership means to them and how their own way and the skills they are affecting and improving the quality of the team and how they are getting more and more success from their team through that leadership. So thank you, Ragini from Mana TV. You're always helping RP physician and covering so many of health related topics in your show. So thank you, Mana TV. This is Dr. Hetar Gaur.
Hi, I'm Vikas Gupta. I'm a psychiatrist based out of Manhattan, New York. Very pleased to be a part of the AAPI event today, Association of Physicians of Indian Origin in the United States. Honorable Consulate General graced the event, and we had a lot of phenomenal speakers and panelists talk and share their vision. It was an exciting discussion, and we all gained a lot of insightful knowledge and information. Really, this was a great event for networking and kind of uh, putting forth the name of API and the excellent work that it does. Thank you so much.
I'm Raj Katara, neurologist from Pennsylvania. I think it's amazing because that's where the whole world is going. Like our Prime Minister Modi ji said, one earth, one family, one health. So we are all in that together. And API is taking a big initiative of doing this global summit wherein we are going to help all the countries in the world as to what's the best in screening and how to prevent the diseases.
Hi, my name is Mani Kamboj, and I'm here as a part of the speaking panelist for API Leadership Summit. It's very great initiative by Hetal Gaur. She has started here at Indian Consulate. This event was organized by Dr. Kathula and his team members. And it's a great initiative what he has planned to connect the bridge between US and India, especially for the people living in India to avail more modern technology healthcare support that the physicians over here can create and kind of send help to India as well through this network. So I'm very happy and congratulate API for starting this initiative. Thank you.
Hi, I'm Dr. Sanjeev Kaul. I'm a trauma surgeon, and I was one of the panelists on the conversation about leadership, styles, and substance. And I've been asked about the API summit, the global summit in India. I think it is amazing that it's going to be held in October. It's very exciting, particularly with the leadership that has these ambitious goals. And I'm looking forward to being a part of it because API has been doing amazing work and it's very inspiring to be a part of it. And I look forward to being there in October.
Yeah, hi, good evening. I'm Dr. Rakesh Dua. I'm a pediatrician in Brooklyn and I'm past president of API QLI, which is a subchapter of National API. Today we were invited by Dr. Kathula for this event, leadership event, and I think it's gone very well. They really worked hard for this and all the speakers were really excellent. And I'm already retiring, but for young people, maybe a lot to learn about how to be a real leader. That you should have the vision first, and you should prove, like, that everybody should trust you. So you should present yourself in a great way that people like to follow you. You should have conviction about yourself and conviction in what you do, and that's how you become great leader. Thank you.
So we have several media friends here, and I really appreciate Ethel Gore, Ajay Ghosh, and Sunil Ali for helping me out to bring all the media friends here. Relationship with media is very important for any organization because ours is a non-profit organization, and it presents several thousand physicians in America of Indian origin. So this is very important to reach to the community, not only physician community, but also community at large. What kind of programs we are doing, how they can get benefited from that. So the newsletter from AAPI goes to only a few thousand people, like probably 8 to 9,000, because we have database for that many people, even though we have 15,000 dues-paying members. But that's not enough. For example, the programs we are doing, bone marrow drives or million miles of gratitude, things like that. So to reach out to the general public here, Indian diaspora especially, so we need media help to get the message out. So that's why we have all the media friends here. So we are, I think this is the biggest press conference in the history of AAPI. How can we really include the technology in preventing diseases, especially cancer and heart attack, which are one of the more common causes of death. So technology like eye breast exam, which is like a small device, handheld device. Mammogram machine costs so much money, it is not mobile, it can be if it is a big truck or something, but this is a handheld device, people can take it anywhere, even a healthcare worker can actually screen with that device with accuracy, 90% accuracy. And anything you want to say, Ethel, Board of Trustees of AAPI, and she's the host of tonight's, this leadership retreat, and she's the one who put together all the speakers, wonderful speakers. We thank them for coming here this afternoon and enlightening us. So, Dr. Sudhir. Thank you.
Hi, dear friends, Honorable Consul General Pradhanji, and dear friends. Well, I think what Satheesh, our President, has described AAPI's advocacy and diplomacy when we in Delhi, I think excellent ideas. And whatever AAPI is doing here, all are the great ideas. But I would like to add a couple of more things because now, as we discussed yesterday, myself and Dr. Satheesh, we were in North Carolina. We had our Vijay Medical College alumni gathering, and there also we discussed this issue that, of course, India has came a long way. India doesn't need really what we used to do 20, 30 years ago, sending we started the, if you remember, CAT scan machine and MRI machine and those things. And now, and fund and all these things, but now India needs more than that. I mean, India doesn't need really fund, but India needs exchange program for the medical students, those who are coming, because all the medical students, those who wants to get the residency here, they need to have observership. So we all approve the leadership of Dr. Satheesh Kathula, what we should have some kind of structured thing that we can give observership to those students which they need to get the residency in a different field. So I think we should do that. Also, we should get exchange of the faculty from the India and start global CME, what we are doing in the Global Physician of Indian Origin, where I'm going to be incoming president next year. So this thing really will teach the young generation state-of-art education from the Western countries. And I'm sure Dr. Satheesh is going to do that, and all my support will be with you, both ways, as a doctor and as a media person. Thank you. Thank you. Okay, thank you.
All right. Hi, everybody. Thank you all for coming, especially all my media friends. And just for those of you who doesn't know me, my name is Dr. Hetal Gaur. I'm a board certified practicing OBGYN in New Jersey, and I am board of trustees of AAPI. This is my second year. And this wonderful idea of meeting with our press came after some discussions with Dr. Kathula, president, and Sunil Hadi, and we decided that we should do this kind of communication between AAPI and media, because so many good things AAPI as a physician organization we do, and we sometimes don't kind of put those things in media, and we don't realize how much power media has and how many things can be lost in translation. And by media being as our partner, not only they will spread our message across and reach to general population, right? Because we as a physician, we have a limited number of people that we see in our office, and we can impact them through our practice and our clinical knowledge through hospitals. But media has much wider range of viewership, of newspaper readers, radio listeners, and we want to partner with them and get our message across and also learn from them, right? Today's idea is not only to tell about Dr. Kathula's vision and what we have done and what we are planning to do, but also learn from our media partners what we should be doing, right? Because they are in touch with population, right? They hear from people, they go to many events, they go to different kind of events, and they meet all different kinds of people, and they hear from the rest of the world what we as a doctors are doing good and not doing good. So we want to learn from them and what they hear, and how we as a AAPI, we as a physician, because as our beloved Prime Minister said, everywhere he goes in the world, everywhere they say Indian physician, Indian IT people, and we are like a pride of our nation, and we have that responsibility that we should do it well. And as Satheesh mentioned, that we have been doing some projects here, like we have clinics, some charity clinics that has been going in the United States that a lot of people were not aware through AAPI, and now we are going to be doing these 3 projects, and he kind of did mention his 3 do's and 3 don'ts, because he goes by 3s right now. So can you start that?
Strong supporter. I want to thank Satheesh to you for bringing this thing over here at the press conference, and thank you for inviting me over here. One of the things which I wanted to bring to your attention and Satheesh's attention is during COVID time, we started with teleconsultation regarding the aspect of COVID and everything. And I think there is a big demand for those things. If we can create some kiosks in India and have some time from the people who are volunteering here to continue that, that would be a great service to, from India, from the rural areas as well as other things. So whoever is in the think tank, I think should think about those things to create some kiosks. Kiosk costs somewhere around about $10,000 in India or something to create. People or patients can come over there, and if you give them a time according to our time here, many of our retired, experienced physicians can be manning those things during that time. So this is just a suggestion and a comment.
I think today's idea about this is for us and the press to talk, so we physicians can brainstorm at our meeting, but I want to open the podium only for the press to ask Satheesh as a president and me as a board of trustee representative, if you guys have any questions, because I want to strengthen our relationship of AAPI with media. So Professor Satheesh, you have a question, and please introduce yourself to other physicians.
I must congratulate AAPI leadership for the initiative you have taken.
Thank you.
I was very disappointed over the last couple of years when AAPI was only thinking of entertainment, spending millions of dollars of people's money. I'm happy you are thinking of something better than that. So congratulations.
Thank you.
But on the right side, my Dr. Kathula, if you educated people about the correct lifestyle, they will become healthy. Am I right? You will be rendered jobless, my friend.
That's okay.
No, firstly, that's a lot of people say that, and there's nothing like we'll be jobless because
Don't take it seriously. I said on the right
there are certain diseases which will prevail.
It was getting so heavy, you know.
Yeah, sure.
Thank you.
Now, my friends, I have lived in India for long. I have lived in tribal areas, I have lived among the poor people, I have lived like a poor man also. What I find, you know, you have a wonderful idea, but let me tell you that you should not be contradicting the government of India by saying that there is lack of education, lack of information, and lack of facilities. Because Modi government claims that we have everything, and we are going to be one of the greatest nations in the next couple of years. So please do not demean my Prime Minister, number one. Number two, it's a very good idea. You want to involve the media to educate people. But do you think mere education, mere information, education is the next step, mere information can solve a health problem?
That's a very good
No,
question.
I'm just, going to put a few questions.
Sure, of course.
Unless you have a deep memory.
Yeah.
So the other thing that comes to my mind is the methodology. How are you going to do it? Government of India has all the departments, all the organizations, all the wonderful media. And they have a good information. My friend Satheesh is here. He is a media man, having ITV and a couple of newspapers. Ask him, how would he be able to help? Now the thing is, we can at the most take your views through the people. And remember, who are going to get those views? Not the poor masses in the villages of India who need your support. Even if they know something about mammography, they know about cancer, they know about blood pressure, all these diseases. You are talking about cancer. Even if they come to know that this is a disease, what is the next step? They need medication.
Right.
Where is the medication? That is my question. And how are you going to contribute your might into ensuring that people in India at the lowest level who do not get even 2 square meal, who live on 5 kg of government generosity, 5 kg of food, 85 crore people. Yes. So how can you make sure that they have the proper medical facilities provided? There are hundreds, and you have the figures. You have the figures very well. Thousands and thousands of villages do not have even primary health care centers. Even if you tell them, okay, this is the medicine, this is the disease, cancer and everything, those are the diseases of the people who have money, the richer people. The poorer people have some other diseases. So I would request you to please focus on what the rural area, you are also concerned about the rural area.
Yes.
So think of what diseases are there and how you can make sure that they are informed, educated and treated for their diseases. I hope my questions end here and I'll wait for yours.
Sure. So those are all great questions, very practical questions. I mean, number one, does mere information will help? Does it help people to be aware of conditions? The answer is yes or no. in cities, they have done in UK, they have done some studies in Europe. What they did was they put all these posters on the buses and transport system.
Ajay, can you
wherever
tell
they had.
outside people to lower their voice and maybe we can close the doors? Thank you.
So they followed that for a year or so, and they actually saw increase in their mammogram rates. So mere information does help. Does it help 100%? No. Is it better than zero? Yes. So that's number one thing. So, and how do we implement this? That's another practical challenge we have. So the implementation is not that easy. So it is completely out of reach for AAPI. We can only educate people. We can only educate government. That's all we can do. And how much we can do is, it's out of scope for AAPI, honestly speaking. I don't want to give you any false information or this assurance. But what we can do is we can talk to the government, we can tell them the situation, the magnitude of the problem for them to understand. So the impact that can make it, can make certain changes. So that's all we can do. And then what about the rural people? So the rural thing is very, very tricky because they do not focus on the preventive health. And it's very interesting to know when we did this Adaptive Village project, we found that 50% of them have chronic kidney disease, 45% of them have kidney disease, stage 1 to stage 4. And we did not even know that. So what happens when you really find these diseases? How are they going to get help? That's the fourth question we had. So that is also a practical question. But that's when the primary care centers there, they have to be aware of that there is a health center. It's not only when we screen people for all the diseases that I talked about, we told them, we also referred them to their primary care health centers, PHCs. So that way they can get some help. So it is not seamless as here. I mean, here people have insurance, people have knowledge, people have resources, I mean everything. But in India, everywhere it's a challenge, and 70% of the population lives in villages, rural areas. So for cities, you can actually make a difference, but in rural areas, it's a big challenge, and that may take generations to actually improve the healthcare for areas.